an original MCM production.
What's going on? What's going on? What's going on? Yeah, what's going on? What's going on? In the meantime, right?
Hello and welcome to What's Going On, the Martha Love Show. I am your guest host today, LaToya Sykes, and I'm pleased to have in studio members of Children's Community Health Plan. So I want you to all say welcome to my guests. We have Mrs. Ophelia Carr.
Hello.
Who's a Case Management Outreach Coordinator.
Correct.
Mrs. Susan Degraaf.
Yes.
Who's a Case Manager and Registered Nurse.
Yes.
And Mr. Anthony Hurd, who is a HMO Member and Advocate.
Member
Advocate.
HMO Member Advocate.
HMO Member Advocate. Welcome.
Thank you.
So we're going to get started right away. We have some questions for you. Okay. All right. The first question, Ms. Ophelia.
Yes.
What are our standard procedures after a client is discharged from the hospital?
Well, standard procedures is giving a member a call once they get home, seeing how they're doing, ask if there are any questions, any concerns, any information that they missed when they was in the hospital. So it's my role is to make sure they have a primary doctor to see them after they get out the hospital.
That is very important. I remember going to the hospital with relatives and they don't have that. But tell our audience why that's important.
It's important because you need to know who's going to take care of you if you get sick again. If you go into the hospital, at least you have a doctor who knows your history, know who you are, have some form of information about what health factors that you may have that they didn't know about before, and just having a doctor to talk to when things come up.
Great. So who is the childless adult population?
Our childless adult population are those members or people in the community who did not qualify for the HMO, Children's Community Health Plan standard plan, who do not have children. So they're considered the childless adults. And they have children that's maybe grown or just never had any children. So that's the population that I work with on a daily basis.
Okay, great. So how many are in the childless adult population?
Roughly about 550 plus people. That's just for March only.
So how do you identify this population? Are they self-identified? Like, how does that work?
It's identified by the state of Wisconsin,
Okay.
by the case system.
Okay, great. So how important is it to recognize this population? So I happen to be one of those individuals in this population.
Okay.
So I really want to know, I want everybody to know, how important it is to you to recognize this population.
Well, it's very important. Everybody should have health care.
Yes.
Everybody should have a good health care system, have a health care provider that listen to them, not just to anybody. So it's very important to make sure you get the right services at the right time.
Okay, and how do you engage and follow up with this population?
Phone calls, reach out. If members need information, I send resources to them. I also send my business card because you may want to speak to me at the time when I'm talking to you, but you may call back months later saying that you need something. And I always tell members, if I don't have it or I cannot find it, there's a team around me that can answer those questions for me too.
Awesome. Thank you, Ms.
welcome.
Ophelia
You're
from
welcome.
our Children's Community Health Plan.
Thank you.
Now to you, Ms. Susan.
Yes, ma'am.
What is a PNCC?
PNCC stands for Prenatal Care Coordination. It's a state benefit that's available to all members of Badger Care Plus, pregnant women who the program is available through their insurance companies and also through other organizations. Okay. Our PNCC program is called Healthy Mom, Healthy Baby.
Okay. So what are the goals of the program?
The goals are, the reason we named it Healthy Mom, Healthy Baby, the goals are to assist the member to have a healthy pregnancy. We want them to get to term. We have things that we like to talk about. We like to talk about safe sleep and breastfeeding and having a plan for birth control afterwards. But it is a member-driven program. It's a voluntary program. And so the goals are set together with the member, with the pregnant woman. She gets to set the goals for how she'd like to spend her time with us.
Good. How does a pregnant woman get involved?
We get lists from the state when a member qualifies, when they are a new enrollee. Okay. A lot of people do not have health insurance or do not have access to an HMO until they are pregnant.
Oh, okay.
In Wisconsin, virtually every woman who is pregnant qualifies for Badger Care Plus, and qualifies for this program. Among the other benefits of Badger Care Plus, they usually have no copays and no deductibles during the pregnancy. Okay. We get a list from the state, therefore, of those members who qualify. We also get letters from OBs, the doctors themselves. We have a process that rewards them for letting us know when they have a member of ours who's pregnant.
Okay.
They can also contact us directly, and so a member can somebody who is a member of our health plan can call our line directly and enroll in the program.
Awesome. So what is the eligibility requirements?
If they're eligible for Badger Care Plus and they are in Children's Community Health Plan, then they almost always qualify for PNCC, for HMHB.
So someone might say, well, how do I know if this program is for me? How will we get that question answered?
I think that the idea is that it's educational, but it's also about just having an extra person of support. Almost everybody needs a team.
Right.
And whether you have a partner who's supportive, a family that's supportive, or maybe you don't, the prenatal care coordinator is somebody who comes alongside you to provide extra support and becomes part of your team to help bring all the pieces together. So the coordinator part of it is about making sure that the healthcare provider, the OB, and the member and her family and any other referrals that she might need are all on the same team and working together towards the good of that mom and baby.
Oh, awesome. So then where do you meet?
Usually we meet in the member's home. If she's not comfortable with that, we'll meet just about anywhere. It's a home visiting program, but that doesn't mean it has to be your home. It can be McDonald's or Starbucks or your doctor's office or the library if somebody's not comfortable with meeting in their home.
Okay, great. So how often do you meet?
We usually meet about once a month. The state requires once a month. Some people want to meet more often than that, and we're able to do that as well.
That's good. So when you have a meeting, so what does the general meeting look like?
It looks a lot like this.
Okay.
Except that we're probably in somebody's home and there are probably children and dogs underfoot.
Nice.
Which
so
is
that doesn't cause a problem.
I love that part.
Awesome.
Awesome. It really is. We are nurses and social workers, and but we are not coming in and taking blood pressures or doing weights or doing any of the things that the medical provider does. We are meeting in a collegial partnership with that mom and whoever else that she'd like to have with her. So sometimes they're dads and grandmas and other people involved. And we work on the goals that we've set together. So the first meeting, we get to know her risk factors and her goals, and then from then on, we talk about that and do education as she'd like.
Okay. So what are some of the questions that the prenatal care coordinator may be able to help answer?
Things about the medical care, certainly. A lot of people are seeing an OB, but don't really understand, don't get the questions answered about the physical process of pregnancy. Most people don't talk to anybody about the emotional changes that happen with pregnancy.
That's very true.
And those are as predictable as the physical changes, but nobody ever tells you that. We also really are focused on making sure that our member gets dental care, because that's very important during pregnancy. And because she has great access to insurance at this time, we want to make sure that we take advantage of that. A lot of our members struggle with emotional or behavioral problems and need counseling or need that kind of support. Those are things that we can help with. We love to do the educational part of it, but that's only part of what we do. Certainly we can educate everything about normal pregnancy and labor and delivery and breastfeeding and baby care, but also, like I said, the biggest component is that personal support.
Great. So if I'm hearing you correctly, my prenatal care coordinator can help me address things like when I should go to the doctor, how will I get to the doctor, like what are signs of labor.
Exactly.
And any other questions that I have, especially when this might be my first time going through this process. And I love how you share to talk about some of those other things that are related to your pregnancy that you may not automatically identify as part of the process.
Right.
And things that you don't think to ask questions about because you don't think of them as part of the process. I like that. And then I'm assuming this person can also help with what my baby may need.
Absolutely.
So help answer that question.
So it's getting ready for the baby, and that isn't just about the physical changes or the medical care. It's also about, do you have a bed for your baby, and do you have a safe place to live, and are you hooked up with the resources in the community that are available to you?
Okay.
To help your family function at a higher level.
Awesome. Awesome. So let's go back to if we have the visit in my house or whoever this person happens to be. So who is this person? Who's coming to my home? What's their background? Do they have kids? For that person that's new to this process, help me help them feel comfortable.
Well, the members of our team are social workers and nurses.
Okay.
Not every PNCC program is that way, but we have a pretty high level of education and experience with our prenatal care coordinators.
Okay.
Social workers and nurses, and they may or may not have kids, some probably about half and half as well. but they are, for the most part, very experienced in the community and have spent a lot of time with families, working with the community, have a good understanding of what's available.
Okay.
And we also work on this team. The advantage of being a PNCC program that's housed in your HMO is that we work with a team that has advocates available and has a dental advocate who you'll meet in a little bit, and has nurses who can follow up and can track where things are going with your medical care and with your insurance. I'll turn to Anthony if a member has a question about their coverage or they're having issues getting access to medications or to other services.
So let's talk about flexibility then. I guess my last question for you. So how does it look if I start out and I say, I'd love to meet once a week or once every other week, but then I start working and my schedule changes? How is flexibility handled?
Well, we visit Monday through Friday from early morning to early evening at the convenience of the member. The question sort of also brings up the idea that if somebody got to the point where they could not visit, it just was not practical during that pregnancy, and this has happened for people, we can also do phone visits, and we can meet at the OB's office at the same time you have your appointment, so you can meet something. But it's very, very individual. Certainly our schedule changes every day, and it's meant, we're usually very much in contact with the member by phone and by text, and we're very flexible.
Great. This is awesome. So my prenatal care coordinator is really one of my teammates.
Exactly.
You know, I get a chance to ask you all the questions to help me feel comfortable with this process and to have you walk through the process. And I love the fact that I could have you join me at my doctor's visits if that, you know, happens to be a good place for me, because when we're going through this process, it's the first time and you really don't know what to do. You know, sometimes having your advocate there where you can go through your questions will help you, one, not forget some of the things that you want to ask, you know, and two, help you follow up with some other questions that you may not already know to ask. So, great, this is great. All right, thank you, Ms. Sulan.
Thank you.
All right, Mr. Anthony,
Yes.
you're up next.
All right.
Tell me a little bit about what function does the Children's Community Health Plan play in providing needed resources to the community as well as their target member population?
All right. Well, that's pretty much the area that I'm in. My job is to educate the members regarding their medical providers, the medical benefits that they're covered for, how to get their bills paid should they come across some, and there's maybe a loophole that they've fallen through where they're not able to get access to providers, specialists, dental, various things like that. So not only do I do that in-house, but I also go out into the community, per se some events, maybe resource, health fairs, various things like that, that would be able to give the Children's Community Health Plan an opportunity to be seen and access the members and engage with them and provide the information that they need in order to get the care that they deserve.
You know, I have to say that in looking at the opportunity to talk to you all today, I looked at your position and as an advocate, and I recall seeing you at different events in the city.
Right.
And I never realized the magnitude of help that you're here to provide. So I didn't know that I could really come to you and say, Anthony, you know, I need an advocate, let alone all the other services. So let's talk about those services. What other services are offered by advocates?
Well, the actual access to resources like behavioral health, dentistry, specialty care, and then we have some caveats that would include access to getting a hold of food resources, housing, clothing, and various things like that, as well as utilities. So we have a plethora of things that we do provide for the members as well as the community, and so that they'll understand exactly what they need to do in order to get assistance.
All right, great. You know, I'm overwhelmed, but I'm really appreciative to have you here to share this information. So where would a member of the Community Health Plan call to get this assistance?
Sure, they can contact 1-800-482-8010.
So 1-800-482
8010.
8010.
Yeah, also I'd like to just throw in there too, we also have a website, which is childrenscommunityhealthplan.org.
No, I had that. childrenscommunityhealthplan.org. That's childrenscommunityhealthplan.org.
Yes, ma'am.
Okay, great. And so I can call that number if I'm experiencing dental-related issues.
If you're experiencing dental-related issues, you need access to any type of specialist, vision care, behavioral health, anything like that, or if you may have received a bill in the mail that you know you were covered for those dates of service, you'll be able to contact number, and they'll be able to resource you. And actually, that number will go to all of us. Okay, so what does that mean? It's a connection between the HMO Member Advocates, the PNCC department, as well as Ophelia's department, and then you'll be able to get access to whatever you need. We are all one big team. I know that words keep appearing in our conversation, but it really is true. The Children's Community Health Plan is a huge team of resources that we provide and work towards assisting our members.
You know, it seems like a novel idea to have Children's Community Health Plan work as a team and to be able to contact one person, and because you're interconnected and you're communicating, you know, have the right person get back to me. So I am very impressed and excited to have a great team come together like that. So how does an advocate help our members, and what role does that person play? Well,
it's often one-on-one, and it can be either, if we're in the community, it can be one-on-one, face-to-face.
Okay.
If we're on the phones, same scenario. Whatever the situation is, again, we can go down the line. If you need a medical provider, I can get you access to that.
Okay.
If you're having difficulty scheduling an appointment, I can help you with that. If you're having difficulty having a bill paid or having a service approved, I can assist you with that. If you have questions about what is covered and what's not covered under the HMO plan, I can assist you with that.
Okay. So what are the business hours you can reach an advocate?
7:30 a.m. to 6 p.m. in the evening.
7:30 a.m. to 6:30 p.m.
6 p.m. in the evening.
6 p.m. in the evening. Okay, great. And then how can a member have access to the providers that are in network with Children's Community Health Plan?
They can either check it by way of our email website, or they can give us a call, and we can search them out for them and make sure that the connection is made.
Okay, great. So one more question. Yeah. How can I meet my advocate?
Right here.
Ah!
No, actually, we're actually very functional within the community, like I say, in various resource events. Health fairs, resource fairs, employment fair. We're doing them all. We do several of them several times a year.
Okay.
Okay. Quite often during the summer months. But you know what? If ever you want to really meet an advocate face to face, you can give us a call. You can make a connection and come down to our office, and we'll be glad to meet you.
Let's get that number one more time.
1-800-482-8010.
And the website is Children's Community Health Plan. Thank you for joining us, and thank you all for being here to share this awesome information.
Thank you.
Thank you for having us.
Thank you.
An MCM production.